Let's talk about what it means to quad concentrate drips. This is very much ICU language, but I'm going to give you some visuals and explain this, and hopefully by the end of this, you will have it up in here. A lot of the drips that we give patients, especially the vasopressors, have different concentrations. So for example, here, these are 3 different concentrations of Levophed. Levophed is a vasopressor that we use. It's typically kind of our first line in most situations. But the green bag, this is a 4 milligram and 250 bag. Your blue is an 8 milligram and 250 bag, and then your pink one is 16 milligrams and 250. And at my hospital, we even have a 32 milligram and 250 that our pharmacy makes up. So for your patients that are maybe on lower doses, or maybe they are getting this Levophed through a peripheral IV, you are going to want to kind of stick with the lower concentration bags. But when your patients start to get on higher doses of vasopressors, or if they're on multiple vasopressors, if you are on the lower concentration drips, your patient is going to be getting a lot of volume. And I'm going to show you kind of like a math example here. Say that your patient is getting 50 mics per minute of Levophed. Your patient is getting the 4 milligram and 250 concentration, which is 16 mics per milliliter. That means that your patient is getting 3.125 milliliters of fluid per minute, which means over an hour, your patient is getting 187 point something milliliters of fluid. That's a lot of fluid per hour. But let's say your patient is on the 16 milligram in 250 concentration, also at 50 mics per minute. 50 mics per minute at the 16 milligram in 250 would be about 0.8 milliliters per minute. Times that by 60 minutes, that gives you approximately 48 milliliters. 48 milliliters per hour compared to 187 milliliters per hour is a big difference in fluid, especially if it's over multiple hours and if your patient is on multiple of these drips. So when we say quad concentrated, we are making these drips more concentrated so that we are giving less fluid or less volume to the patient. So your 4 milligram and 250 bag and your 16 milligram and 250 bag, your 16 milligram is quite literally 4 times, or quad, more concentrated than your 4 milligram bag. Now, we kind of use quad concentrated as just like a general term. Some of these drips don't actually get quad concentrated. They may be just double concentrated, but still the general concept is the same. Less volume is going to be given for your higher concentrated drips because we can give the same dose, but less volume. I'm also going to add that if you are giving these higher concentrated drips, you really should be giving them through a central line. Okay, that's it. Bye.